Hello everyone, I am Dr. Kadambari Naniwadekar, a special education teacher with All India Institute of Speech and Hearing, and I am working here for the past 15 years. My area of expertise lies in the educational management of children with autism spectrum disorder. Till now, we have talked about what is autism spectrum disorder, how can it be identified, and what are the characteristics of autism spectrum disorder. Now let us delve into few of the frequently asked questions about this disorder. The first and foremost frequently asked question being, can we identify autism at an early age? Yes, it is possible to identify autism at a very early age. There have been instances when autism has been identified at 18 months of age. Just that the parents have to be little conscious of their child's development, which you have learnt about in the previous section. Few of the key factors which a parent can look into for identifying your child early are: first, your child doesn't have a social smile, which develops generally by 3 months of age. If your child is lacking this social smile, then you need to consider if your child is going towards some abnormality. Secondly, the child is having an empty gaze. The child is just looking at things without any purpose, and you feel the child feels always lost in his own world. And next, the child is not even babbling or speaking a single word by 1 year of age. Second frequently asked question is, what are the early signs of autism? For people like us who are working in the field, we call them as the red flags. The following are few of the red flags for autism. The first, as I mentioned previously, having no social smile by 6 months of age. Secondly, no babbling or not even a single spoken word by 1 year of age. The third, the child is unable to point to objects using his or her index finger. The next, the child is unable to wave bye whenever we ask them to do so. The child loses previously acquired speech by 2 years of age. No meaningful utterances, not even 2-word sentences by 24 months. The child is not responding to name call whenever they are called for at home or in any other environment, and a lot of repetitive behaviors. By repetitive behaviors, we mean that the child always likes to go around to the furniture again and again. The child keeps lining up objects like his or her toys, shoes, or even the furniture. These are just few examples of repetitive behaviors. What is the difference between autism and autism spectrum disorder? Autism spectrum disorder is an umbrella term used to refer a range of conditions with repetitive behaviors, poor social skills, and lack of communication. Autism is just part of this broader category. And autism spectrum disorder, as we know, covers a range of characteristics and conditions, and autism being just one part of it. The next question, which is frequently asked, is that if children with autism spectrum disorder also have intellectual disability. Yes, it is possible for children with autism spectrum disorder to also have intellectual disability as a comorbid condition. Almost 70% of children with autism spectrum disorder have intellectual disability. But at the same time, it should be noted that not all children with autism will have intellectual disability and vice versa. Whom should I consult if my child has autism spectrum disorder? The first and foremost person for your child has to be his or her developmental pediatrician. The pediatrician is the one who is going to show you the way ahead in this problem. Next, visit a reputed institute like the All India Institute of Speech and Hearing and get a formal assessment done for your child. Once you go to the institute, you can meet speech-language pathologists, psychologists, clinical psychologists to be more specific, occupational therapists, and special educator. Once all these assessments are done and it is ascertained at what level your child is or at what severity the child's autism is, your child will be prescribed few therapies. Kindly continue those therapies and see improvement in your child. Will my child ever improve? Yes. A child with autism spectrum disorder can always improve and lead a meaningful life. The only important thing that we need to keep in mind is early identification and intervention. If the child is identified at an early age and consults the qualified professionals, continues with the therapies on a regular basis, it is definitely going to help your child and they will one day be able to lead a meaningful life. Will my child ever be able to go to a mainstream school is another one of the most frequently asked questions. The answer to this is again yes. Your child can and should go to a mainstream school for their further education. As with any other therapies, if the child is identified early as having academic difficulties by the special educators, they can be worked upon with qualified special educators and be mainstreamed into the regular schools. Also, the Government of India has included autism as a disability in the Rights of Persons with Disability Act and also under the Right to Education Act. And as per these acts, these children with autism spectrum disorders are allowed for free and compulsory education in all the schools. Do children with autism dislike other people? And can they ever make friends? It's wrong to say that children with autism spectrum disorder are disinterested in people. They have an innate desire to make friendships. It's just that because of lack of social and communication skills that they are unable to do so. If these skills and these deficits are identified early and worked upon at a proper time, they will for sure be able to make a lot of friends. What do we mean by savant skills in autism? Savant skills are nothing but the exceptional skills that children with autism do possess. But it is to be noted that not all children with autism will have these savant skills. These exceptional abilities can be in the field of music, dance, cognition, mathematics, or even calculations. We have had individuals coming to us who would be able to remember dates almost 50 years back or even be able to calculate the days and weeks which can be almost after 20 years from now on. There are children who are able to solve almost 150 to 200 pieces puzzles and even able to identify which part of that puzzle is missing. These are few of the savant skills. And if we look around, we will have many more of such exceptional children with autism. It's just that we need to keep an eye on their strengths and work upon them. What happened to these children when they grow up? The traits and the characteristics of autism will remain same. It will go with them their whole life. And as we have heard earlier, this is not a disease which will go away. The characteristics, the traits will go ahead with them, but the way those are expressed may vary with age. To talk about adulthood, some adults may require support in employment, while some will be able to go independently to their workplace. Some of them will be able to live alone in any house or with their parents, while some will require supported living. And for that, we have a lot of supported living facilities in our country which are coming up. So these were just few frequently asked questions that we come across while working in the field of communication disorders and especially autism spectrum disorders. Please feel free to add in comments and ask for any more clarifications from the experts working at the All India Institute of Speech and Hearing. Thank you.